We are observing during the last 10 years a huge increase in prevalence and the severity of clinical manifestation. And we know now that food allergy depends on a defect of immune tolerance. So we need to target immune tolerance to stimulate to prevent or to treat the food allergy in 2023. So our talk will be on this topic. How we can target immune tolerance? We know that diet and microbiome are the two most important aspects in this network. So we discussed about how to modulate the gut microbiome early in the life with the aim to drive immune tolerance and to protect the future generation against the occurrence of food allergy. We know now which are the mechanisms of the gut microbiome and the metabolites produced by the gut microbiome in inducing immune tolerance, and this can be the future target of intervention for prevention treatment of food allergy. The dietary factors that are able to shape the gut microbiome structure and function at the end of the day to stimulate or to facilitate the occurrence of food allergy. And these dietary factors are mainly linked to an increased consumption of ultra-processed foods. Ultra-processed foods are commercial foods. Unfortunately, now up to 50% of the caloric intake, for example, in Italian children, are driven by ultra-processed foods. And we know now these ultra-processed foods are able to shape the gut microbiome composition and function, increasing the abundance of detrimental bacteria able to induce inflammation and allergy. And we know now that these ultra-processed foods are able to influence the activity of our cells at the GI tract level as well as the immune system level. So we know now which are the mechanisms of action. How we can use these basic science as well epidemiological and clinical evidence for our clinical practice. Right, we can limit the exposure to ultra-processed foods. In this case, we can prevent the occurrence of allergy or other allergic disease. At the same time, we can restore the gut microbiome composition and function using prebiotic, probiotic, or postbiotics. And we can use also this modulator of the gut microbiome or the immune system together with the new strategy or skin epicutaneous immunotherapy, as well as biologics, in particular in severe form of food allergy in the pediatric age, as well as in adult patients. And altogether, this integrated strategy could be very effective in protecting the new generation of subjects and inducing immune tolerance and reducing the discourse and protecting again the occurrence of other allergic manifestations in patients already affected by food allergy.